My name is Funton Daniel here in the great state of Texas here in the United States. But I want to wish my sincere condolence to the Nigerian people and on behalf of the Muslim community in Nigeria and for the loss of Buhari, former military leader and former civilian president, and but I wish them, it's a big loss for them and a big loss for the country, Nigeria as a whole. But however, my concern is that these most powerful leaders in Africa, former military leaders, former president, he understands the needs of the people. He understood the needs of the people, and yet he do nothing about the people. Let's take, for example, Nigeria is a giant oil country, and therefore, as a president of the Federal Republic of Nigeria, he has the moral obligations to alleviate the economy, and especially in medical infrastructural development. Infrastructural development is the key factor to Africa, but yet they have this massive power, and yet they do absolutely nothing. Let's take, for example, they rush to UK, they rush to Europe for medical treatment, and yet they have this massive power to make a significant difference. One thing for sure, and most of them that are still rushing to Europe, they think that going to Europe, they are going to meet a different medical personalities. But unfortunately, they meet the same Africa who are physicians in the various areas in different capacity. There is one case that I can emphasize, They realize that they don't take notice, even though they travel for medical treatment in Europe, but they don't take notice that the physician or the internal medicine is an African. The nurse providing care is an African. The technician, patient care technician, is an African. The specialist, the cardiologist, is an African. The pulmonologist is an African. The surgeon is an African. But they don't make clear judgment that I rush to Europe for medical treatment, but the people whom I met in these facilities provide me essential care are of African descent. So they don't see any correlations in this regard. But unfortunately, that is the plain truth. Now they return, they don't look at this emphasis, say, okay, if these people are Africans doing this particular job, this special area for treatment, what can I do? The people need an infrastructural development with a clear mindset. The time you exit the airport, the time you drive to the hospital, the infrastructural development, and that is what Africans need. But they have this massive power, and they cannot do exactly nothing. The money, they hide it in various foreign banks. Instead of carrying on infrastructural development, including healthcare facilities, the state-of-the-art technology, research, those are the things that when you have power, you ought to do those things for the people. Let's take, for example, Paul Biya in Cameroon. He rushed to Europe for medical treatment. But what he doesn't know, that the same people he rushed to be treated are Africans, and that they can make those correlations, distinction. And that is exactly what happened to Buhari. He rushed to Europe for medical treatment, but unfortunately, he doesn't make correlation that those working in Europe are the same Africans. So he doesn't make those correlations. Okay, what is the significant difference, and what should I do back home to make those differences? infrastructural development and funding. That is what you need to do. But anyway, we wish the people of Nigeria happy the memory. I'm sorry, I just lost my thought. But anyway, I appreciate you for watching, and make sure you share. At the end of this, make sure you share and copy, email, whatever you do, like, and keep the message flowing. That's what Africa must do now, and to improve our economic structure. Thank you. Have a wonderful day.